Very good evening to everyone. We are here with yet another virtual session, and today's speaker is Dr. Andrew Seffer. And he joined with us with a wonderful day, and I'll introduce him. He is a mindful instructor and trainer, workshop facilitator, and author living in the island of the east coast of Canada. He specializes in developing and implementing multi-week mindfulness programs in two areas for people dealing with mental health and addiction issues. And one more thing, he is a authorized instructor who became practicing mindfulness in 1968 in his book, Anxiety, Stress and Mindfulness, a do-it-yourself guide to wellness was published in 2018. And we will have a discussion or we'll have our today's session on this book, which was published in 2018 with a small introduction. If I've missed, sorry for that. Thank you so much, sir, for coming on our platform.
Thank you very much. I appreciate the introduction. So I'm going to see, it says host disabled participant screen sharing.
You can share, sir. But now you can try, sir.
Yeah, okay. So, okay. Okay, so the title for our session today is Anxiety, Stress, and Mindfulness. And I don't need to tell you that we have a very up-to-date form of anxiety and stress in the form of COVID. Very challenging. And so this is just a very recent form. Of course, there are many forms of anxiety and triggers for it. Global warming certainly is a major concern, and it is about the future, and nobody knows what's going to happen. So when we have indications of global warming that are very threatening in the present, certainly that's one form of anxiety that gets triggered. This is a fire in California. And of course, sea level rise, nobody knows where that's going. The scientists can, of course, forecast, but it's affecting low-lying areas all around the world. And whenever we have a situation where there's something that is uncertain, something that's unknown involving the future, that's ripe territory for anxiety. This is another type of situation that's anxiety producing. We used to be able to trust the newspaper that we were reading on a regular basis and not have a lot of reason to be questioning the veracity of the news. That has changed, and we have to be very vigilant when we're reading the news. We can maybe trust certain sources more than others, but when there's a lot of fake news out there, it's like the sands underneath our feet are shifting all the time. That's ripe area for anxiety. Loss of security. Everybody's on social media these days, which is wonderful, but there are some hazards, and one of them is that everyone is posting themselves looking at their very best, and maybe some of that is they're showing off, bragging, posting them in certain parts of the world for vacations that are very highly desired, as an example, and then the people looking at those images are feeling inferior, feeling that they're not as good as their friends and so forth. So that's eating away at their self-confidence, and it's another area of anxiety in the modern world. So my sense of anxiety is that we're off balance. We can't count on maybe what we could count on in the past, and so again, we're unsure and we're feeling insecure. Looking to the future, we're apprehensive. We're not so optimistic as we used to be, and there's the insecurity. Generally, we're feeling threatened by. There's so much that's unknown that there's a lot of anxiety. In the workplace, it might be that you've got a lot of competing demands. Maybe you have different bosses and who are assigning you different projects. Some of them are maybe conflicting, so you don't know where you stand and how to balance those priorities. There could be frequent changes in our requirements or the methods that we use to do our job. Again, the frequency with which these things are shifting is very unsettling. And the job description that we have might be changing a lot more often than it used to. Technologies, the rate of change in technology, of course, is huge, and it's almost impossible to keep up with. But sometimes our work depends on our ability to adapt to new technologies, new releases, and so on. Maybe the leadership in our organization is not reliable. We found out the hard way in the past, and so we're always sort of looking over our shoulder and wondering, if we should go ahead or not with a directive, so on. So there's just a lot more uncertainty. With anxiety, it's not a pleasant feeling, and so people who have experienced this feeling are not, looking forward to having that happening again. So they associate this negative experience with the feeling of anxiety, and you could say they feel that anxiety is a bad thing. They want it to be gone. They want to get rid of it. They want it out of their life, so they don't have to feel that way. So what they're doing is they're pushing it away. So whatever we're using the word anxiety, but it will be a whole other discussion to explore what do we actually mean by that word. It's different things to different people, and it's not a fixed thing. But whatever we mean by anxiety, we're pushing that away and avoiding it. When we do that, obviously we're distancing ourselves from it. That's what we want to do, distance ourselves from it. But there's a downside to that, which is we can't get to know it, and we can't have a relationship with it as long as we're pushing it away. So there's really no way for it to resolve itself, within us, within ourselves. So there's no way for it to resolve itself. It's going to stick around in one form or another. And that's a problem. So we end up not wanting it to be here, and then we end up creating the circumstances that cause it to stick around. So a big part of that is the discomfort of the anxiety. And we're pretty much ruled by comfort. Like we like being comfortable. We want to be comfortable, and we do not like discomfort. Okay, so we have a polarity there. when we have difficult feelings, we don't want them around. It's the same thing. We want to push them away. We want them to be gone. If we have disagreements with people, we might be the type of person that doesn't work well with conflict. So we just want to avoid, maybe we avoid the person. And we don't like being inconvenienced. We want everything to be good. So we're, everything is handy for us, and we know we can handle it. We know we can deal with it. So the bottom line of this, again, is that we're dividing our experience between what we like and what we don't like. What we don't like, we want to get rid of. It's a knee-jerk reaction, and it's about avoiding. We want to avoid these things that are causing us difficulty, pain, discomfort. We don't want to relate to them. We don't see any value in relating to them. We just want them out of here. In mindfulness, through the practice, we're going in the opposite direction of that. We're developing a tolerance for discomfort, believe it or not. There's a virtue to that. And so we're going from judgment to non-judgment. Judgment is saying we have this polarity, this is good and this is bad. We're making a value judgment. This is bad, which is based on that polarity. We filter our experience through that. So we're saying, well, it's possible to live in a different way, that we can have, we can be non-judgmental and take things at face value and experience them as they are. And then if we need to make a decision, whether we want this in our life or not, or whatever, we can do that. But that's happening after we've started with like an even playing field. And so in mindfulness, the effort is oriented to cultivating this level playing field, as opposed to seeing things as either good or bad. All of this that we're talking about, it takes it's time. It's none of this happens overnight. The practice of mindfulness is key in helping to cultivate these different elements we're talking about. Again, with discomfort, when we have an understanding that everything is impermanent, nothing lasts, nothing stays the way it is. When we have an understanding about that, that makes it a lot easier to tolerate discomfort. If we thought it was going to be here forever, we wouldn't be able to tolerate it. So awareness of impermanence is something that does develop through the practice. We'll go into this further, but we're sitting in meditation practice and our mind is going crazy. We have very wild mind, and one idea after the other is coming to us. That's totally normal. But we do experience the fact that these different thoughts and ideas, feelings and emotions come and go. We actually experience that. So we experience the impermanence of all these things, mental events. Again, with discomfort, we're learning that we can actually turn towards it and face it instead of running away from it. There's acceptance if we do feel, let's say, fear. And we're in a situation and, okay, yes, I'm afraid. We don't have to do anything immediately about that. We can recognize that that's happening. We can acknowledge that feeling and be there, accept that it's happening. I mean, otherwise we're making up a story about, that there's no such thing as fear. But actually we can experience it as it is without having to do anything, which is acceptance and letting it be. So this is a very different kind of relationship with feelings and emotions than maybe what we're used to, but this is healthy. For one thing, when we're pushing things down and suppressing them, there's been quite a bit of research to show that that's not beneficial in the long run. So this is going in line with health. So here are some words for this approach and this, this orientation is that we're actually inviting whatever is here, we're inviting it and we're allowing it, we're greeting it, we're attending, so we're aware, we have our faculties and our attention here. We appreciate it. We can even say that we appreciate it, but certainly we accept it. So accepting things as they are is a big element of mindfulness. We're not trying to turn something into something else. We want to be able to relate to whatever's here. And then based on that, that's reality. Based on that, we can decide to do something or not, but it's got to be based on reality. I would be remiss if I was talking about mindfulness and I did not mention simplicity. We have a lot of complexity in our lives. If you just take a look at your mind over a period of a minute, and everything that was zipping through the thoughts, feelings, emotions, sensations, perceptions, everything that we were registering, it's a phenomenal amount of activity. These things could be on the same topic or they could be on totally different topics, and they're all going through our mind. That's pretty complicated. And in the outer world, if you had to buy shampoo, you went to the drugstore and you figured it was going to be a simple errand. Just go there and find your shampoo and go to the checkout. You realize that it's much more complicated. There are, I don't know if it's 50 or 100 different types of shampoo on the shelves and conditioner. So, if you're a thorough type consumer, you're going to want to check these out. Like, that can be a big job. Just the fact that there's that many choices for someone who's just trying to buy some shampoo, to me, illustrates there's a lot of complexity in our lives. So I'll just go back a second. So with simplicity, we're talking about bare bones. The practice, which we're going to do together, is very basic. There are no bells and whistles, and we're going to be working with our posture, our breathing, and our attention. And in the modern world, usually things are much more convoluted and involved. So the ability to engage in a very simple activity and practice is quite powerful. And we see the contrast between with this and the complexity that we're working with all the time. So our thoughts are, of course, a huge part of our lives, and we can say that we are learning about them so that we can know their nature. We can know what thoughts are all about. It's a thorough, it's not like you're a student and you're studying something, but you're in this case, you're a student of mindfulness practice, and you do learn some things about thoughts while you're sitting there with them, pretty much the whole time you're practicing. So that's what I mean by learning their nature. And when we know what thoughts are, we're in a much better position to deal with them in a healthy way. When we don't know what they are, we're going to be on the receiving end. We're going to be a victim, you could say. So we're learning that we can actually recognize our thoughts, recognize when our mind is carried away, and then return to a stable anchor of attention. In this case, it's the breath. So we come back to the breath each time. And that's very powerful, being able to notice when, basically notice when we're lost up here. It's very valuable. Again, just the same as with feelings and emotions, we experience the coming and going of our thoughts. And again, okay, so that means that they're not the monolithic things that we figured. They don't have all of this eternal power or authority. So we see that they actually come and go. There's a phrase that the mindfulness people use, metacognitive awareness, which is saying that negative thoughts and feelings are not attached to a self. They're mental contents that come and go. So that is significant in terms of anxiety. Let's say you say, I am anxious. I am anxious. So it sounds like that's who you are. You're anxious. Anxiety is who you are. This is suggesting a very different way of expressing yourself. If you're feeling anxious, fine. You say, I'm feeling anxious. So it's a feeling that is present right now. It wasn't present, let's say, an hour ago, and it's not going to be present in 5 or 10 minutes, but it is right now. So if our language expresses this understanding, it's going to help us basically let these things go, like they're ready to go, and we're hanging on to them with this by identifying ourselves with them. One of the things we learn is that our thoughts are not necessarily true. They might be, might not be. So say thoughts are not facts. But when, let's say, again with anxiety, that we have, we're afraid to leave our home and agoraphobic. And so we've built up a belief about what's going to happen if we walk out that door. Okay, and so maybe we're telling ourselves that if I walk out that door, I'm going to have a heart attack. Okay. If we believe that thought, first of all, it's probably going to keep us in the house for sure. But if we know that that is it's just a thought, it may or may not be true. That takes a lot of power out of it and puts us in the position to be proactive and make our decisions. So knowing that our thoughts are not necessarily true can be a lifesaver. The catch is that it can be very difficult to have this awareness when we're in that state of panic and anxiety, so on. Very difficult, but possible. But more so, we're oriented being proactive. So we're not waiting to get into that situation of desperation. We're wanting the mindfulness to kick in much earlier, much more upstream, before we're in totally stressed out, and to have the self-awareness kick in. And we'll talk more about this in a little bit. So we're focusing on some of the highlights, some of the key points, not suggesting that we're covering these topics, exhaustively, but these topics are very relevant for people dealing with anxiety. So now with stress, we're talking about when there's a demand on us, and it could be psychological, it could be physical, but it's a demand. So we have our homeostasis where, okay, we're good, our kind of baseline level of functioning, and we're good. And then we start getting these demands on us, and so those demands are starting to stress us out. Like it's more than we can deal with, and then that keeps happening, and it gets to be really serious. So I think of stress in terms of demand, some of which we can deal with, and some of which is actually healthy, but too much, no. So, and we're also talking about stress as an adverse circumstance that disturbs the normal functioning, right? Like too much demand. But it's important to note that there's two types of stress. There's eustress, which is a positive form of stress, and distress is the negative form. So eustress could be if you're an athlete and you're preparing for a big competition the next day, and you're kind of exhilarated, you're kind of excited, but you're also kind of scared because there's a lot at stake. If you don't do well, your whole life as an athlete could go down in flames. So it's mixed. But in this case, we're going to look at it as mostly positive. And when it's positive, it has beneficial effects in terms of energy. And optimism and the ability to work with challenges and so forth. So there are positive aspects in that situation. Distress is the opposite, where there's too much demand on us. We can't handle it. Well, at a certain point, it gets to the point where we can't handle it. Initially, yeah, we can handle it. So if you're the kind of person who has a hard time saying no, people come up to you, can you do this? Can you do this? This would really mean a lot to me. And you keep saying yes, yes, yes. What happens is you get a lot on your plate. And at a certain point, once again, there's too much on your plate. So you're overcommitted. That's a form of stress. The demand that's on you is too much. Or you could say it this way, you're always trying to please. You want the other person to be happy. So you go the extra mile to please them. Maybe you're overpromising. And so we have this picture here of the woman with all of her notes behind her. That's obviously totally, that can't be supported by any reasonable life. It's just like the weight of that, of having that there. If she ever turns around to look at that I think that would be stressful just to look at them. Look at all those pieces of paper. Over here we have an electrical box that's totally, everything's plugged in. You've got more stuff to plug in. You don't have an opening there. So that's kind of the feeling of too much demand. And as you know, there's the straw that breaks the camel's back. So you've been letting all of these demands pile up, saying yes, yes, yes. And at a certain point, it doesn't take much to break that back. It might only take one piece of straw because you're at a point where you can't take anything more, not one more straw. So the way I see mindfulness in terms of this scenario is, again, we're not saying, okay, that if you're there, that you need to have the mindfulness and awareness to see how much stress has built up and to not put the last straw on the back. We're not saying that. We're saying that way before this happened, we want to be able to see what's going on with like the demand and the stress, and to be able to discern that, okay, now is the time where I'm going to stop taking on anything else, right? So this is an example of creating a boundary, but that comes from awareness, from mindfulness and awareness. And if we can do that, then we don't have this escalation, resulting in a collapse. So we want the mindfulness and awareness to kick in during that process somewhere. The earlier, the better. With stress, we have the part of the brain, the amygdala, that is sort of like the quarterback. And when we sense that there's danger or threat to us, we this alarm signal goes off, the amygdala gets activated, and adrenaline and cortisol are produced, and they're circulated throughout the body. So that's the stress response, or the fight or flight. And we obviously need that, because if there is something dangerous, that is going to save us, or threatening. And that's why we still have the amygdala, because it has been essential in keeping us around as a species. So yeah, we definitely need this. But it can cause problems. There's something called perceived stress, where we have the perception that there's a threat or danger, and we want to protect ourselves from that, which would be demand. Okay, but turns out we're wrong. There's no actual threat or danger, but we think there is. So when we think there is, the stress response kicks in, and these chemicals, body chemicals, if we have a lot of them, they're not healthy. Okay, so we don't want this response triggering often. And I think mindfulness can be helpful. There have been different studies done on resiliency and so forth, indicating the effectiveness of mindfulness in terms of stress. So let's see, we're talking about a practice that's been around for over 2,500 years, and it's specifically about working with the mind, which of course is the most complex part of us, and the brain is extremely complex, but that's what we're working with. For the last 20 to 30 years, this practice has been recognized as effective for anxiety, stress, depression, and addictions, among other things. One thing that distinguishes it, I think, from a lot of the more conventional healthcare practices is that the person who is suffering, the person who is having a problem, is doing the heavy lifting. I mean, if this is going to work, the person needs to do mindfulness practice, right? And on a regular basis, like every day, ideally. So that's the heavy lifting. The doctor can, or the healthcare professional can, of course, be helpful in different ways. But it used to be, well, the belief was, okay, I'm going to go to the doctor, and the doctor's going to have all the answers and tell me what to do, and but it's much more so, okay, learning how can I do this myself. So it's a very self-directed, type of practice once you've received the instruction and so on. It may sound sort of grandiose, but in a way, we are retraining our mind. For example, with the basic sitting practice, where we recognize our thoughts and come back to the breath, that's major. We're introducing a discipline into an undisciplined mind, and that can have a lot of ramifications. All of them being positive, as far as I know. Okay, so with mindfulness, first of all, we have an orientation to the present moment, which means, well, normally we sit here, we have a thought about something that's going to happen tomorrow. Maybe we're nervous about it. we're not prepared. Then we think about something that happened 5 years ago, a project we worked on, and there was someone involved with that project. We were attracted to them. Whatever it is, there's no rhyme or reason what comes into our mind. So we could be spending a lot of our time in the past and the future. But the only problem with that is the only opportunity we have to actually make a difference in this life is in the present moment. We can't make a difference in the past, it's already happened, or in the future, it hasn't happened yet. So the training, being present moment oriented, is very key. With anxiety, typically it has to do with the future, not always, but so if you have an illness that is about where you're thinking about the future, and you have a practice that is showing you how to be oriented to the present moment, that can be quite powerful. And people who have done my workshops have indicated that that aspect has been very helpful. We are training our attention. We tend to have a very poor attention span nowadays, quite a bit worse than it was even 5 or 10 years ago, from what I read. And our attention is key to anything that we want to do. Our attention is very important. So we're actually training our attention. It's getting stronger. We mentioned about the non-judgment part, also very important. And that also relates to how we treat ourselves, because we tend to be very judgmental and critical of ourselves. And when we do that, we're shooting ourselves in the foot, and we're not going to be making progress with that. So this is showing us that we can actually turn around and be kind to ourselves and non-judgmental, and which relates to the self-compassion, very much so, that until we're able to direct kindness towards ourselves and feel compassion when we're having a hard time. Let's say we've just failed at something, maybe we tend to just give ourselves a kick, but what we're learning is we can actually, appreciate the effort and know that a lot of times things don't work out, the kinds of things that we would say to a friend, that we can start kind of, applying them to ourselves. So self-compassion is very important. With all of this, we're developing awareness. There isn't a particular element of it. And also building resilience, so the ability to bounce back from adversity. And that has to do with our relationship to our feelings and emotions, that we're not getting as affected long-term by difficult feelings and emotions because we have some understanding of them, similar to our thoughts. And all of this, we are investing in our mental health. So one thing that is interestingly different from conventional models of medicine is that we're oriented towards health, not illness. Like in my workshops, we spend very little time talking about our problems and our diagnoses and our past, very little time. the whole thing is devoted to, okay, you know, we have all these capabilities right now that are hidden and we hardly know about them. And we're working on getting to know our mind and so forth. So all of this stuff uh, is about health. Um, our health is intrinsic, just like if we cut our finger, if we don't run off to the emergency room right away, we let it heal, it's going to heal. You know? I mean, if it's not a major problem, it's going to heal. And we also have intrinsic qualities and capabilities like compassion, kindness, and wisdom within us that are usually buried under all of the confusion and running around and so forth. Our confusion, our aggression, our negative emotions are all temporary. And again, when it's not a matter of people hearing this and then saying, oh, okay, well, I guess that's the way it is. It's a matter of experiencing it through the practice. And when we actually experience it, it goes into our bones. And then, that's when we could have some self-awareness come into the picture if we're in trouble. It's got to be in our bones, is what I say, not just an idea. So these inner resources, we can actually connect with them. We can bring them out. And over time, we're starting to identify more with our goodness, our compassion, and so forth, than we are with our problems. And that's very healthy. Our workshops are community-based. They're not happening in hospitals or healthcare facilities. They're happening in organizations that have space in the community. We use their space. And so we're not really aligned to probably a lot of the ways that other programs are being done within the traditional healthcare system. We sort of do things, our way, and they seem to be working. And I should mention, I'm not a clinician. I was introduced as doctor. I'm not a doctor. I'm not a clinician. So the program delivery of, we're delivering these 8-week, 10-week, or 12-week programs, and we don't have clinicians involved. It's probably a bit unusual. I don't know. Sometimes there's a psychologist I consult, depending on the program. I'm offering one right now for people with suicidal thoughts. And so that's a high-risk group. I'm going to be seeing a psychologist next week to talk about a few things about that, get his advice. That's totally fine. Of course, it makes sense. But the whole program itself is not being delivered in a clinical way. Instead, we have mindfulness meditation instructors. And the last year or so, we were delivering to a group of people suffering from depression last year. And then we have this current group, suicidal tendencies. And so for those, we've had the meditation instructors and also a community support person in the room who has suicide assistance training if it's needed. We just want to have them there if it's needed. So all of these practices I've been talking about, they're coming from the Buddhist tradition, but everything is delivered in a secular way. So the teachings and practices derive from Buddhism. And John Kabat-Zinn, who you may have heard of, he's sort of the granddaddy of the current mindfulness movement, made huge contributions. His study and background was in Buddhist context with Buddhist teachers. But the brilliance was he's the one that sort of started this idea of secular mindfulness. And so that was brilliant. And I'm continuing to do the same. We don't have references to religion, culture, any rituals. We don't have any foreign words. So that makes it very accessible. People don't have to feel like they need this other training or education. And it also makes it suitable for institutions like schools, prisons, so on, because they don't want to be presenting. I don't want to speak for all of them, but I think a lot of them don't want to be presenting something that is representing a particular religion. So, okay, so with all that, if you're still with me, we're going to go ahead and do some of the mindfulness practice. We're going to start with what's called breath awareness, which is the foundational practice. And then we're going to segue to the mindfulness awareness meditation. So we'll go ahead and get started. So first of all, okay, I assume we're all sitting in chairs. If you're sitting, for instance, on the side of your bed, if it's a firm bed, it's fine. We don't want to be like sinking down into anything. Or of course, in India, there could be lots of people practicing on the floor, cross-legged, or however. I realize I'm speaking to a population that's probably extremely well versed in a lot of what we're talking about. So we'll start with our feet on the floor. And normally they're on the floor, but in this case, what I mean is we bring our attention to our feet on the floor. So we notice the contact there. And anything else we notice. So I said we're doing attention training in this practice, and that's a good example. Bringing our attention there. Now we're going to bring our attention up to our seat in the chair. So it just means that we're giving our mind a place to rest. And here it's resting points of contact between our seat and the chair. Now we're going to be sitting upright. So we tend to slump a lot, slouch. So we're going to bring our torso up. And the lower back, you could have a curve coming in to the lower back. If you do, great. It's not necessary, but that can give some support for this upright posture. And we want to have our head up. So over our shoulders, actually, because our heads tend to be, coming forward quite a bit. So we bring it back. And that's, we have a dignified posture now. And you could let your shoulders drop and you're looking out. So we have the eyes open. I know a lot of people have eyes closed. We have eyes open, which goes with our orientation, which is an open orientation. And now we're looking ahead, straight ahead, and then we let our eyes go down, maybe 30%, just down a bit. And we have a soft gaze, which means that we're not focusing on anything in particular. Normally, we do that. Like the chair leg in front of us will end up focusing. So here, we want to just have an overall sense or awareness of the space. And also open to the environment. So if we hear something or smell something or so forth, then that's all part of the present moment. We're not trying to shut that out. So it's open. And also kind of the big picture, the general sense. We can have our hands, palms down on our legs. Our lips could be just slightly parted, which will allow the air to pass through our mouth if it wants to. So we're just simply sitting here. And now we're going to direct our attention to our natural breathing. We're not doing any special kind of breathing. We're not doing diaphragmatic breathing, so on. It's our normal breath. And our attention goes along with it, sort of like a co-pilot. When our mind wanders and we start thinking about different things, we just gently bring our attention back to our breathing. We're not actually trying to accomplish anything. There's nothing that we can do right, and there's nothing that we can do wrong. We're just very simply sitting here. When we notice our attention wanders, we bring it back to our breathing. That's all we're doing. And if you do notice that you're being judgmental and saying like things like, I don't think you're doing it right, and why do you have so many thoughts? What's wrong with you? If you're saying anything like that, that's a great opportunity to turn around and be kind to yourself. You don't need to be judging the judger. You can just start being kind. And then come back to the breath. If you notice that you're starting to slump with your posture, then you just pick yourself up and keep going. Okay, now we're going to bring our attention to our out breath. So this is mindfulness awareness, and it's oriented to the out breath. So we're here. Now we got our attention on the breath as it goes out. Breath goes out into the atmosphere. And of course, it dissolves into the air. So now our attention is out in front of us, out in space. And the normal thing is to wonder what we do next. But in this case, we don't do anything next. So what we do is we just simply hang out. We go from doing to being. Just be. What we're doing, we're taking a break, like a complete break from our perpetual busyness and doing. Just taking a break. And that lasts until our next out breath. Okay, so the in-breath happens, of course. We just let that happen by itself. We don't need to be managing it. Let it happen while we're doing nothing. Then the next breath out, our attention goes out into the atmosphere and the breath dissolves. And then there's this space again we use the word gap, G-A-P. It's like an in-between place. We hang out. And then the next breath out, we go out again. So it has that alternation between going out with the breath and gap, doing nothing. So we'll do that for just a little bit. And just like before, when you notice your mind is somewhere else, just gently bring your attention back. And now there's a final additional tool, which is that when we notice our mind has wandered, we say to ourselves the word thinking. Say thinking, and then we come back to the breath. So we're inserting this one additional tool. So that was breath awareness practice and then mindfulness awareness practice. If we break down the practice, we have feet on the floor and seat on the chairs, grounding. Upright posture is dignified and integrity with sitting in this posture. Eyes open, I mentioned it's about the openness of the practice. It's also that we're not shying away or trying to get away from anything in the physical world. We're right here with it. And the soft gaze is a sense of bigger view. Instead of getting stuck on details, bigger view. And that goes with the awareness of the environment, that the everything around us it's part of this present moment, whether we like it or not. And that we actually develop a relationship with the phenomenal world. The world that we can see, hear, taste, touch, and smell becomes our ally. And we are part of it. We're not this isolated individual existence. We're part of something vast. Natural breathing. We just don't embellish the breathing at all. So there's this stable anchor of attention is important. That's the breath. Also the posture. When we come back to the breath, we can notice our posture, and that's another anchor of attention. We're becoming familiar with our thoughts, feelings, emotions, so on. And gives us a bird's eye view of our own mind that we wouldn't have otherwise. It puts us in the same room as our pain and confusion and difficulties, suffering. Again, we're not trying to get away from them. So yes, okay, they can be here. And I want to say something about this notion of titrating our exposure to negativity. When we say, okay, we want you to turn towards your difficulties, maybe someone suffering from depression has a lot of difficulty with sadness, for example. So we're not saying, okay, you need to rub your face in sadness now. I'm not saying that. It's possible to turn towards sadness and acknowledge it without getting too close to it. So the idea is that a chemist can titrate a solution from a beaker into a test tube, for example, where he's just pouring, or she is just pouring a little bit of a solution into this test tube at a time. They're not pouring the whole contents into the test tube, right? They're doing a little bit at a time. So that's considered titrating. And there's a clinical psychologist in Seattle who has been using the word titrate in relation to helping people who have suffered trauma and PTSD in particular relate to their emotions. So the idea is that you can turn towards it and be aware of it and touch it, but not have too much exposure to it at a time. So you do that, and then you can turn over, take a look at, or listen to the lawnmower that's going on in the background from your neighbor's yard. So again, with your attention, you're shifting your attention to another aspect of the present moment. You're not escaping to something that's not here. You are noticing something else that's here. And then when you're ready, you can go back, take another look at this. And so it's self-regulation of difficult emotions. and negativity. Yeah, we talked about meeting our judgment of ourselves with self-kindness. With mindfulness awareness, we have the out-breath orientation. And what we're doing is we're starting off here in the body. The breath is coming, obviously, from our body. So we're starting here, and then we're going along with the breath as it goes out. We're going out, outward. So you can say that this approach it's decentralized. It's not all about me and what's going on here. It starts here and then it goes out. Breath becomes space. And we do this practice, particularly the gap where we're not doing anything, just being. We start to see that we can survive without having a rat race going, like all of these things that need to be done, to-do lists and errands and whatever. That kind of busyness, like we don't need that. Now, maybe some of the time we might, but here we are, meditation practice, and we have this section called gap where that's not happening. And guess what? We're still alive. So we don't need it all the time. So going back to anxiety and stress, it's important to know what our body cues are. When I'm feeling anxious, maybe my chest gets really shallow, or my breathing, or maybe my shoulders get stiff. So if we know our body cues, then when those things are happening, we can take that as a cue to, okay, it means there's some anxious situation, and we can start being proactive, right? So that's one really good way to be able to catch yourself early, way before you're in a total panic. Pausing is a very important part of mindfulness. And we have a practice called Head and Shoulders. There's different pausing practices, but the gap that we have in our mindfulness awareness is pausing. But pausing, during the day when you're busy is a challenge. And so that's an important one. We have, and being curious, gathering information. When we notice, let's say, anxiety or stress is the way to go. Recognizing thoughts, staying grounded, also very important with either one, anxiety and stress. I saw a quote from a Canadian Mental Health Association website one time that said that when we're stressed, our thoughts about the stress are a bigger problem than what it is that we're stressed about, because we talk ourselves into things becoming big problems, and that becomes a stress in itself. And anything we can do to become more proactive and less reactive is going to be healthy. So there's a fair bit of evidence on effectiveness of mindfulness, both for anxiety and stress. So I assembled a few examples here. Effective mindfulness-based therapy on anxiety and depression. It's a meta-analytical review, Hoffman. There were 39 studies that he looked at with 1,140 participants. He said his team said results suggest that mindfulness-based therapy is a promising intervention for treating anxiety and mood problems in clinical populations. This is an older one that John Kabat-Zinn was involved with John Miller in 1995. A 3-year follow-up and clinical implications of a mindfulness meditation-based stress reduction intervention, the treatment of anxiety disorders. A previous study of 22 medical patients with DSM-3R defined anxiety disorders showed clinically and statistically significant improvements in subjective and objective symptoms of anxiety and panic following an 8-week outpatient physician-referred group stress reduction intervention based on mindfulness meditation. So that was what they said. And they said that they did a 3-year follow-up and the gains had held over the 3 years. Finally, they said, we conclude that an intensive but time-limited group stress reduction intervention based on mindfulness meditation can have long-term beneficial effects in the treatment of people diagnosed with anxiety disorders. So this one, mindfulness-based cognitive therapy for generalized anxiety disorder, Susan Evans. Much smaller group, 11 participants, age 49, average. So mindfulness-based cognitive therapy is MBCT, may be an acceptable and potentially effective treatment for reducing anxiety and mood symptoms and increasing awareness of everyday experiences in patients with GAD, generalized anxiety disorder. So those were a few examples in the literature. These are about stress, and of course, the mindfulness-based stress reduction was specifically developed for people dealing with stress. So this is a meta-analysis of Paul Grossman based on 20 reports, controlled and uncontrolled studies with similar effect sizes. These results suggest that MBSR may help a broad range of individuals to cope with their clinical and non-clinical problems. So another one on stress, weekly change in mindfulness and perceived stress in a mindfulness-based stress reduction program, Ruth Bayer. 87 adults with problematic levels of stress participated in the 8-week MBSR program. Significant increases in mindfulness occurred by week 2, and significant increases in perceived stress occurred in week 4. The last one is the evaluation of a wellness-based mindfulness stress reduction controlled trial, Kimberly Williams. 103 adults participated in the 8-week MBSR program with 59 in the intervention group. Intervention subjects reported significant decreases from baseline in effect of daily hassles, 24%, psychological distress, 44%, and medical symptoms, 46%, that were maintained at the 3-month follow-up compared to control subjects. Okay, so now I want to share with you outcomes from my program, which is the one that was measured a lot was navigating anxiety and stress through mindfulness. 2 weekly sessions for 8 weeks, which I started offering in 2013, I believe. So these are the topics of the 8 weekly sessions: introduction, mindfulness and anxiety, key elements of mindfulness and awareness, similar to what we're going over here, but from a practice perspective, anxiety and living with uncertainty and change, stress, responding versus reacting, attention, our precious resource, recognizing thoughts and being present, working with fear and fearlessness, and basic goodness, a breath of fresh air. So those are the 8 topics. The quantitative evaluation, we weighted and aggregated the first 5 groups So we had a total of 40 participants. This evaluation report is based on 40 participants. There was the pre-intervention, the post-intervention evaluation, and the pre had a 40.3 was the average score, and it went to 56.6, difference of 16.3. So that's a 40% improvement in the score. That's for 40 people in 5 groups. Okay, then further with quantitative, they looked at the evaluation statements that had the biggest change. And so the first one was, I get stuck with the storylines, which is like the voice inside our head. Get stuck with the storylines that can make me feel anxious, and I don't know how to pause or interrupt this pattern. So there was a 60% improvement with that one. I think over and over about things that have already happened, 45%. My storylines keep the everyday stress rolling, pull me out of the present moment, 40%, and so on. Then the participants in the evaluation were asked, what are the main things you remember about mindfulness? So by far and away, this is a category. So this is, they answered in their own words, and then their responses were categorized. So that similar responses were grouped together. And 22 people said some version of this: increased awareness of thoughts, what is happening around me, being present in the moment. So that was by far the most beneficial or the most memorable aspect for participants. The next one, relation of thoughts to emotions, recognizing negative thoughts before they escalate. And there was also recognizing and breaking away from habitual patterns and interrupting storylines. Okay, so those were the top ones. There were some other ones there. And we talked about discomfort earlier. Accepting discomfort. There were 6 people who that was the top line for them. Then they were asked how helpful the workshop series had been for them in dealing with anxiety and stress. And there were 40 altogether. So 12 said extremely helpful, 14 very helpful, and 14 somewhat helpful. In what ways has this been helpful? Learning a new technique, practicing a new way to deal with anxiety and stress was the biggest one. Allowing negative thoughts and emotions to arise and dissolve. Being more open and less depressed, and so forth. So that's the group I started offering around 2013. And since, I'm going to tell you about my book in a minute. Since the book came out, I revised what I'm presenting. It's now called Anxiety, Stress, and Mindfulness. And I'll be offering a group starting in July 20th. And people can either sign up for, for 6 sessions or 12 sessions. So this one will be starting on Zoom. I've got the time frame and the Eastern Standard there. I will have more information on my website. That's my homepage. I don't have the poster yet. Within the next 4 or 5 days, I'll have it on the website. safermindfulness.com. So here's my book, which probably no surprise that the title is Anxiety, Stress, and Mindfulness. And it came out in 2018. And typically I include a copy of the book And in this next series, it would be included as well. So we, I assign certain relevant chapters and sections for what we're discussing and so forth. Available on Amazon, Barnes and Noble. And finally, so the website does have some information you might find interesting, particularly the outcomes. I shared the outcomes from the one study, but we have all of the outcomes posted there for all the different groups: depression, addictions, penitentiary, so forth. So feel free to check that out, the outcomes. There's other stuff on the website, videos on the resources page, so on. But I want to thank you for your attention. If you're still with us here, really thank you. And if you have any questions or anything you'd like to explore, please, probably easiest is to email me, especially coming from India. I read all my emails, I answer them all. I appreciate them. So I hope you found this worthwhile.
Yes,
And
sir.
yeah, I appreciate the invitation from Own Your Growth. It sounds like a great organization doing some good work. So thank you.
Thank you so much. It was so kind. I have two questions to you that is very basic and that would cover the whole presentation. That I was here for 1 hour 30 minutes, but it was like just 10 minutes. It was over, and I feel that I should continue with you for 1 hour 30 minutes more. So that's my pleasure working with you, sir, and experiencing such basic and most effective techniques. It is most
Great.
effective techniques.
So did this pretty much all make sense to you?
That is very much makes sense to me because my field is yoga and naturopathy, where we do learn breath workshop, pranayam, if you have heard
Yep.
about the term.
Yep.
So it was a depth of it.
Yeah. Well, good. So let's see, I'm going to stop the share. Okay. So how long was it?
It was just 1 hour 30 minutes exactly with theory and practical.
Okay. All right. So what's your next step
My
with
next
this?
step is to ask you one question.
Mhm.
If I come as a patient to you and you do not know about me anything, but you have to treat my emotional imbalance which I'm going through, so what will be the 3 factors or 3 points you want to change at the first meeting?
Okay. When you say the emotional imbalance, what are you referring to?
I'm
Emotional.
doing anxiety, because do we have talk about anxiety?
Yep. Yep. Anxiety. Okay. Okay. So you're asking about the first meeting. Well, the first meeting is really, more of an orientation. But now that you've been oriented, except for that 10 minutes, uh, yeah, I think grounding is very important place to start. And basically, the elements that I would see are grounding and awareness of thoughts, and this business with turning towards feelings and emotions and difficulties. So that would come quite a bit later. Like, for example, I'm finishing up the group that I'm doing right now for people with suicidal thoughts. The last session is about feelings and emotions. And I would have liked it to come earlier, but there's too much that needs to come first. You know what I mean? So that's why it's the most challenging part. And so you need all the tools you can get to be starting to work effectively with feelings and emotions, I think.
That's so true, sir. And with your experience, just my second question would continue from here that most of the time we talk about experience or experiencing the technique, what you are teaching. So these two things, according to you, matters when you give a therapy.
Okay, you just mentioned two things. One is about experiencing the technique.
One is about the experience of your journey. These both things could help the patient.
Okay, the first one, experience of your what? Spell that word.
Your journey, sir, journey.
Your journey. Okay, experiencing your journey. Yeah. And experiencing the technique. Yeah. So then, now that I get what you're asking, so what is the question about those two things? Hello, are you there?
Yes, I'm here.
Okay, so what's the question about experiencing your journey and experiencing the technique?
So my question is about if we experience the technique, is it enough, or we should have the experiencing the technique too with the experiences of your life to teach a patient or to take the techniques what you are taking just now as a workshop.
Yes, it's got to be more than just the technique, I think. The group dynamic, I find, is excellent because people do learn from each other. They're not talking about their past or their problems, but they do learn. Someone asks a question and I answer it, and it's really helping this other person. So that's all. I would consider that all part of the journey. I have met one-on-one with people, and it doesn't have that dimension, and it doesn't seem to work very well. Doing this meeting one-on-one doesn't seem to work very well because I can show them the technique, but they need to have more than that. Does that answer your question?
No, no, that's what my request is. And sir, I
Okay.
wanted to conclude with two things with this very important session. What we had from the last 1 year, what we are taking. The first thing is it was so connected to the technique what you explained to us, the
Yeah.
theoretical part, because most of the time we missed out that part. The theoretical is going in another way, practical is
Mhm.
going on another way. But it was
Right.
parallel for me and for the audience who is going to watch this session. Second most important thing is what the techniques, the way you have teached, the way you are practicing this workshop. I say workshop, sir, but because it is so changing for me. If I did for 15 minutes, I feel a change. If I do for a 1 hour a day, 1 month
Mhm.
in a year, it will change
Mhm.
my life definitely. And the person you are taking, like addiction, suicidal thoughts, or anxiety person,
Right.
I hope that they will see this session once again and they can come to you and they can ask you that we need this. This is our requirement as of now. You are us, so you are energy fuel for everyone. So I must say to you, so that is so good of you, sir, to come on our platform, sharing your time,
And
which is so important that we
mhm.
all know, but still you have spare some amount of time for all of us. Thank you so much, sir, to come on our platform.
Well, thank you. It was a bit of a challenge putting all this together, but I'm glad to have done it. And so when will you're going to be putting this up with your other presentations or what?
Yes, it would be coming as a live in a next week, so people can have time to give a reminder in their YouTube where they can see, and we will make sure that you should also reach with your group of people to whom you teach that, because this session is very connected both theoretically and practical with evidence-based approach.
Mm-hmm. Now, actually, you mentioned YouTube. So if I wanted to put it on YouTube, or well, if you're going to have it on YouTube, then I can just point to that. I don't need to post it if you're posting it.
Yes, sir. Yes, sir. We will
So will you?
share a link with
Yeah,
your thumbnail, and we
yeah,
will share with everyone that the message should reach out, that the technique and the importance of this practice is very needful in the current pandemic scenario where each and every individual is fighting for something.
yeah. Okay, well, yeah, thank you very much.
Thank you so
I'm
much, sir,
delighted.
for your time. Have a nice day for you. Thank you, sir.
All right, thank you. Bye-bye.